Welcome to this episode on mental health. In the previous episode, we talked about bipolar mood disorder. In the present episode, we are going to talk about another major mental illness, schizophrenia. The word schizophrenia means schiz, that is split, and phrenia means mind. So, split mind. It is split between reality and imagination. The person cannot differentiate between the two. So, the person is not in contact with the reality. This illness is characterized by two main symptoms: hallucinations and delusions. Hallucination means the person is perceiving something which is not there. The most important hallucination in schizophrenia is auditory hallucination, meaning the person is hearing voices from the surrounding. The contents of the voices may be they are praising him or criticizing him or giving orders: do this, don't do this, go here, don't go here, or commenting on his activities. Or he may hear two, three voices talking among themselves about him. The person may falsely attribute these voices to any bystander and may therefore feel he is saying so and may quarrel with him or even beat him up. And that's why they get into trouble. There are some hallucinations of the auditory type which are not psychopathological. Like early morning, just when you're waking up from bed, or late night when you're just about to go to sleep, or even in clear consciousness you hear only your name being called, then those are not psychopathological and not indicative of this. These hallucinations have to occur in clear consciousness when the person is not sleepy. Apart from this, the second important symptom is delusion. Delusion is a fixed false belief which cannot be removed by any amount of reasoning or proof to the contrary. Here, the commonest delusion that we see is persecutory delusion. Persecutory means the person feels that some people are against him. When two people are talking, he may feel that they are talking about him. These are called ideas of reference. The person feels that people are trying to harm him. People are conspiring against him. People have installed cameras to spy on him. And the whole world is against him. And he tries to protect himself from such persecution. In this illness, sometimes you also see grandiose delusions, in which the person feels he is a great person, he has great powers, he has made some very great scientific achievements, discoveries, and is out to protect the world from disasters. Another delusion that can occur here is delusion of jealousy, where the person feels that the spouse is not faithful to him or her, suspect the fidelity of the spouse, believes that the spouse has several affairs. This type of delusion will lead to a lot of quarrels, maybe culminating into divorce and sometimes even into murder. The person himself has loss of insight into his illness and therefore never seek treatment on his own. Such types of patients need to be taken care of by the relatives so that they control this illness of theirs. What is the outcome of this illness? There are several courses. Some people will recover from it within 15 days without any intervention. These are the brief reactive psychosis that I mentioned earlier. Some patients, in spite of whatever treatment you give to the patient, will show a progressive deteriorating course. These are the ones who usually land up in the mental hospital. But the vast majority are either recurrent courses or chronic stable courses. In recurrent course, there are recurrences and remissions. The episodes come and go. In chronic stable course, the person is continuously in a state of illness, but it can be controlled with the help of medication. This group requires constant treatment. If they have a drug holiday, the relapse are very likely. In this illness also, you can use the shock treatment, the electroconvulsive therapy in refractory cases. Apart from these two main symptoms, there are several other symptoms which define schizophrenia, but in clinical practice, they are rarely to be seen because most of these symptoms used to occur in the later stages of schizophrenia. And today, very few patients, because of the lack of treatment, reach that stage. But in the early stages, these are the two main symptoms. Of course, earlier to that, there are certain other symptoms which get buried under these two symptoms. And what are they? They are called actually primary delusions, which includes sudden delusional idea in which the person gets a sudden flash. Like a medical student got a flash that I know the whole of medicine. Or another person got a flash, I know the significance of life. These are called autochthonous delusion or sudden delusional idea. Then there are delusional perceptions, where the person interprets a normal stimulus in a delusional manner. Like one patient used to say that when he heard the plane fly overhead, he would say, my father-in-law is going to send me abroad. Or when he heard a car honking, he would interpret that as, my father-in-law is going to give me a car in dowry. Delusional interpretations. Then there is thought broadcasting. The person feels that his thoughts are being read by other people, even though he may not say that. And many a time there is thought alienation. The person feels that his own thoughts are being taken out, and that is thought withdrawal, or somebody else is inserting thought in his mind, that is called thought insertion. These occur in very early stages of schizophrenia, but later on, the secondary delusion, particularly the persecuted delusion, the delusion of grandeur, the delusion of jealousy, become more prominent, and these primary delusions are not to be seen in clinical practice. Of course, the treatment of this condition is giving antipsychotic drugs. And there are a wide variety of antipsychotic drugs from which we can choose and help these types of patients. Yes?
In what way can the family help the schizophrenics? The
family has to realize that the person is not aware of his own illness, and rather than criticizing him, rather than trying to browbeat him into accepting his illness, accept it. Not argue with the person, but agree with him, play along. However, the constant endeavor has to be seen that the person needs the medications and try to cajole the person into taking the medicines.
Yeah. Curable, the medicine?
Controllable.
And not be cured completely.
Because the root cause of that neurotransmitter imbalance are the genes. And you cannot alter the genes of the person. So the root cause cannot be removed. And therefore there are chances of recurrences.
Is schizophrenia the same as a split personality disorder?
That is another diagnosis which comes under dissociative states. The multiple personality, where one personality is not aware of the existence of the other personality. You find that more in novels and films rather than in clinical practice.
Can they have a normal life with medication?
With medication, of course. But in the case of those progressive deteriorating course, they are refractory cases. However much medicines you give, in whatever doses you give, the illness does not remit fully.
Then how do we deal?
Then they have to be admitted to a mental hospital
Okay.
so that they don't harm themselves and do not harm others. But these are less than 13% of cases. The vast majority can be helped with medication.
Medication.
Doctor, this autism and schizophrenia, are they correlated?
In fact, autism is childhood schizophrenia,
Okay.
occurring during infancy. The full name of autism is infantile autism. And this is also because of the same chemical imbalance and needs to be treated
From the childhood.
from the childhood.
But sir, few patients like autism, they have been treated by psychotherapists also.
By behavior therapist.
Yeah, in this.
Behavior therapy does help, but it's a very long drawn process.
But medicines are necessary, right?
Medicines are necessary, but it has been demonstrated that with behavior therapy, they can be helped. But as I said earlier, it takes a lot of time and lot of patience on the part of the health giver. Whereas with medicines, you can get quick results with less effort.
Sir, is there any other solution to cure this apart from the medicines?
Like,
Like some therapies, etc.
psychotherapy.
Not psychotherapy, some yoga, etc.
Yoga asanas will help you to strengthen your physical structure. They will not help you to correct the neurotransmitter imbalance.
So pranayam.
Meditation.
Can it be cured by naturopathy or Ayurveda?
Yeah.
In Ayurveda, there are some medicines for mild depressions,
Okay.
which can be tried when the illness is mild. But here also, it has been found that subsequent episodes tend to be more severe and more intense. And then, when the intensity increases, the same Ayurvedic medicine is not able to deliver the goods.
Okay.
And it has to be supplemented with some antidepressants.
So pranayam.
Pranayam, if you consider that to be only a regulation of breath, then it cannot help here. It does help in your strengthening your physical resistance, but it cannot alter the neurotransmitters.
Meditation also. Meditation also.
Meditation, as we understand today, is mainly a relaxation exercise. So it will help to relieve your emotional disturbances. But it has a much bigger role than just merely curing a mental illness or a physical illness. The true role of meditation is to get you in contact with your inner self. So it will be a underuse. And moreover, it is not found to be effective in correcting the neurotransmitter imbalance.
You just calm down probably then. No.
As a relaxation exercise, you just calm down. But what goes under the name of meditation is usually relaxation. The true meditation is to establish your inner contact. In fact, suppose, say you have a helicopter, then you can go places. But if you use the helicopter to buy vegetables at the corner, then you are underutilizing it. So the true role of meditation is much loftier than to be used for treating any physical or mental illness. The true role of meditation is to get you in touch with your inner self. And about this, we shall be talking in the spiritual health. In this episode, we have concluded on mental health. From next episode, we shall take the next section, namely spiritual health, where we will mention about this meditation.